Good question. So buyer and seller activity across all fronts, DSO, private buyer, and sellers has, since COVID's increased for a number of reasons. One is on the seller side, one of the biggest, John was talking earlier about the practice that's been for sale for 5 years. One of the reasons sellers can't get out of their own way is because mentally they're not ready to let go of their dental practice. And those of you in here that own dental practices right now think this will be really easy to walk away from. If I had a nickel for every 60-plus-year-old doctor that sat in front of me crying about the thought of having to walk away from their dental practice because their patients and their staff mean that much to them, I wouldn't be sitting up here. I'd be on a beach drinking Mai Tais right now. So that factor when COVID hit, and those doctors had 6-7 weeks where they were at home, all of a sudden said, man, I could get used to this retirement idea. So we had doctors that we've been communicating with for a year or two that called us up and said, hey, I'm ready to do this. The other side of that is doctors that were nearing the end of their career don't want to put up with some of the staff issues around COVID. Hygienists and hygiene's been a real challenge, I think, with a lot of dental practices, trying to get them to come back, and the fears, having to wear all the PPE, and then just the fear of some of the changes that are coming along with COVID of, we're going to have to implement new air filtration systems, and they just don't want to deal with that. So I think on the seller side, that's what's increased the seller side. On the buyer side, on the private side, what we've seen is a lot of associates got let go when COVID happened. And I think, going back to like 2002, 2005, when the DSOs really started increasing and kind of changed the model for how a dental student comes into the workforce, they felt very much like we are indispensable. And all of a sudden they realized that they were. Some haven't been called back, and some now want that control of, if there's another COVID that hits, I don't want to be the one that gets let go. I'd rather be in some type of control here. I've got access to, what the government might do. And some of them, it's just purely out of, I don't have a job. I need to buy something that's out there. So because of that, it's remained, if you have a good, healthy practice, it's remained a seller's market. I have a listing right now on the north side of Atlanta that it's a very healthy practice. It's running about 54% overhead fee-for-service practice in a desirable area. We put the listing up on, 2 weeks ago, and we've had 5 or 6 offers, and they're all more than 5% above what the valuation was on the practice. So there is demand for good, healthy practices right now. And on the DSO side, the DSOs have, as soon as they saw that the practices were coming back, became very, very active again. And partially is because there's so much demand there's so many sellers coming out there, they're good, healthy practices, that they've become very active. And quite honestly, in the dental world right now, they can get a higher return on their market here than in a lot of other areas. So we're seeing them structured a little bit differently. There's COVID holdbacks that essentially what it's saying is we need to see the practice return back to within 90 to 100% of what it was in the trailing 12 months prior to the COVID shutdown. Most of them are giving them options to be able to earn that back. They still want to give the full value back to the practice. And as far as valuations, and Lee, you may want to chime in on this as well, but we're not necessarily seeing valuations change that much. And the thought behind it, or the mindset behind it is that if you had a practice that shut down for a 6 to 8 week period, that is a problem within that practice. But what we saw was the entire country shut down for that 6 to 8 week period. So it wasn't a myopic, did I use that word right? I read that in a dictionary the other day. And
across the board.
So I'm a Marine. Do you guys know what Marine stands for? muscles are required, intelligence not essential. So I try and get a new word every once in a while and plug it in, and it doesn't always work. But it's not specific to that individual practice, which would then devalue. So if he was talking about waiting earlier, when I go into a practice and the doc, I see $960,000 in collections, $980,000, and then in 2019 the collections were $860. Well, the seller always says, well, it's a $960,000 practice, and we're saying no, and unfortunately it's not. It's in that 800 range. That trailing 12 months is what gets weighted the most when we run those averages. It's not the year that you had the best, because a bank is going to view that differently. The accountant is going to point that out, because once you start seeing declining revenues, you don't know where the bottom is. Sometimes there's a story that can be built around it. But getting back to valuations in general, essentially what they've been doing is still looking at 2019, that being kind of the catalyst year. However, they're factoring in, and we have to now factor in, we've been out of COVID for a good period of time. And what we're looking at is saying, okay, are we back to the same, not necessarily collection levels, because we had the gap with AR. Essentially, AR dried up for a lot of practices during COVID, so you've got to kind of kickstart that and restart that. But what we're looking at is saying, okay, are we within that 90% range of where they were, the average of 2019? And if it's falling in that range, then the valuation is essentially being based off 2019. However, if it's declining, then it's going to have a really dramatic effect on what the value of that practice is. So when we're talking with people and they're saying, hey, look, I'm thinking about selling in the next 12 to 24 months, our story to them is get that production back up, let it level off or increase, because if you've had declining revenues, then you have declining revenues coming out of COVID, it's going to dramatically affect, and it's going to scare a lot of either investors or independent buyers.
State?
Say that again?
Any variation on state politics?
Well, so when I talk to banks and I talk to other people that work across the country, the Southeast has rebounded in the dental community much better than a lot of other states have, because they got the dentist back to work more quickly. So states like New York and California that, out on the West Coast where it took a little longer, they're still feeling the pain. Where here, in my experiences, is the good dental practices, the practices that were strong pre-COVID, have rebounded very, very well. And the ones that were struggling pre-COVID are actually, they're getting even worse. Yes. And a big part of that is they weren't prepared. They didn't communicate with their patient base properly. I mean, I had one of my clients down in Jacksonville, Florida, said that he's been picking up patients because during COVID emergencies, because doctors weren't even returning phone calls to patients that were calling up saying, I blew my tooth out. Well, you think they're going to go back to that doctor? Yeah, probably not. So if they were doing the right things before, they're most likely doing the right things after, and we're seeing those collections and the rebounds come in very strong. So, and then the other part that I deal with and that John probably has to deal with is on the buyer side. If I hear one more time, what's my COVID discount, I'm going to vomit, is that mindset of the buyer of, well, everything should be devalued because it was shut down. Well, again, the entire country shut down, so you can't penalize. If they did the right things on the rebound, then you can't necessarily penalize for that. So you can try, yeah. And you know what? If you have if the practice is not healthy, it may be our advice to them that, hey, you've got a willing and able buyer, you may want to consider this. But if you've got the $1 million fee-for-service practice in Buckhead that's running at 50% overhead, I'm going to tell them, well, there's 5 other buyers behind you that are going to, pay the asking price most likely. So, and that's part of, we talked about what influences value. The 3 things that I would tell all of you that are current practice owners is, one is location. You can't do a whole lot about that if you already own your practice. The reason a Buckhead practice is going to value or sell for more than a Tifton practice isn't because there's probably more cash flow in the Tifton practice than the Buckhead practice. There's more revenue, it's kicking off. However, there's more demand in Buckhead than there is in Tifton. I've had a rural practice can't think of the name of the city, in a small town in the middle of nowhere, Tennessee, guy working 3.5 days a week, collecting almost $700,000, putting about $380,000 in his pocket. Took us 3 years to sell that practice, and he sold at about 60% of collections. Not because it wasn't a good practice, because we had one person that talked to us about it in a 3-year period. So if you would have put that in Nashville, we'd have sold it 3 times over in a month for well above, 85, 90% of collections.